Let's dive into the world of feline infectious peritonitis, a disease that was once considered fatal, but now presents promising treatment options. Currently, unlicensed formulations of GS-441524 are globally available, but legal access to compounded formulations is improving. Countries such as Australia, Canada, the United Kingdom, and the United States have access to these formulations. Most of the global supply of compounded formulations comes from the Bova Group, with international distribution to various countries. In the USA, Stokes Pharmacy is also producing formulations, creating more options and competition in the market. The main drugs used to treat FIP are Remdesivir GS-441524, Molnupiravir, and EIDD -1931. Remdesivir is a prodrug that is metabolized into GS, while Molnupiravir is converted into EIDD in vivo. It's important to note that GS is an intermediate metabolite with antiviral properties that is incorporated into the viral RNA. The active triphosphate is pharmacologically active and occurs intracellularly. The standard treatment duration is 84 days, but recent studies show that 42 days may be effective in some cases. The recommended dose of Remdesivir or GS is 15 mg per kilogram per day for non-neurologic and non-effusive cats. For cats with neurologic involvement, the dose is 20 mg per kilogram per day. Remdesivir can be administered intravenously slowly, usually over 20 minutes to 2 hours. Oral GS should be administered fasted, followed by a small amount of food to help with ingestion. It's important to consider that there is significant variation in the plasma concentrations achieved in cats on the same dose. Dividing the dose may be considered if the clinical response is inadequate. Most cats receive oral GS tablets or suspensions from day 1, with successful remission rates due to higher doses. Do not attempt to convert doses from unlicensed formulations to compounded formulations due to variability in drug concentrations. A recent study suggests that a shorter treatment of 42 days may be effective for less severe cases. However, it is crucial to individually assess each patient before stopping treatment and ensure they have achieved a clinical resolution of FIP signs. For cases with manifestations in the spinal cord, such as urinary incontinence, recovery may be slower or permanent. In these cases, the stability of neurological deficits for a considerable period may indicate residual spinal cord trauma rather than active viral disease. Always keep cats above 15 mg per kilogram per day and do not adjust the dose downwards with weight drops due to effusion resolution. Avoid stopping treatment before 12 weeks unless there is supporting evidence for a shorter duration. Avoid prolonged use of corticosteroids beyond the first 2 weeks, unless there is a good reason, such as IMHA or severe neurological manifestations. Perform physical exams every 2 weeks and adjust the dose as needed for weight gains. Focus on clinical response in the first 2 to 4 weeks of treatment. Consider blood tests at the 1-month mark to ensure everything is normal before discontinuing medication. CBC and biochemistry are mandatory, and AGP and serum amyloid A can be helpful. If dose increases are needed, recheck every 1 to 2 weeks after adjustment. If dose extensions are needed, recheck every 2 weeks until remission is achieved. Adverse reactions to Remdesivir are minimal, especially with oral formulations. There may be ALT elevations, but it is unclear whether this is a disease or drug effect. Eosinophilia may be a drug reaction. The main side effect is injection site discomfort and potential skin irritation with unlicensed formulations. Molnupiravir and EIDD are not directly comparable to Remdesivir and GS. Rodent studies found mutagenic and teratogenic effects with Molnupiravir, so it is recommended to wear gloves when administering these drugs. Molnupiravir should be reserved as a second-line antiviral due to safety concerns and potential resistance. However, it is an effective option if GS is too expensive or inaccessible. Adverse effects include leukopenia, folded ear tips, brittle whiskers, flaky skin, nausea, vomiting, anorexia, and muscle wastage. Some studies have reported alt elevations and jaundice. Protease inhibitors like GC-376 and Paxlovid show potential in combination with other antivirals. GC-376 is undergoing veterinary registration. Paxlovid, which contains nirmatrelvir and ritonavir, has been used off-label for refractory cases with promising results. A treatment trial is a diagnostic option in obvious cases, but make sure to do as much diagnostic work as possible to rule out other pathologies. Not all FIP effusions have high protein and low cell count. You can vaccinate and neuter cats during treatment, usually waiting 2 to 3 months after treatment ends. Do not reduce the dose to save money. Instead, treat aggressively for as long as the owner can afford. You should still treat retroviral-positive cats, as they can still have a better quality of life. Do not treat enteric coronavirus as a prevention for FIP, as this can lead to antiviral resistance. In summary, Remdesivir and oral GS should be our first-line antivirals. Switch to Molnupiravir or EIDD -1931 if you are seeing a poor response or if it is entirely cost prohibitive to use first-line antivirals. Consider adding a protease inhibitor for refractory treatment courses. Treatment guidelines for FIP are under development with the collaboration of veterinary specialists, virologists, clinical pathologists, breeders, and owners from around the world. Stay tuned for these future guidelines, as this field is constantly evolving with new research being published weekly. Thank you. Until the next episode.